We are live.
Thank you. Welcome members of ACP and welcome all other listeners. I must pass on the greetings from American College of Physicians, India chapter to all of you. From today onward, we are going to start another very unique series of lectures on the well-being component for doctors. And well-being is a thing which is not only meant for a patient, but also it is required very much for the clinicians, doctors, and other healthcare workers. Most of the healthcare workers remain in so much stress that they are very much concerned about the health of the patient, but not of themselves. And it has been seen by many of the studies that healthcare workers, especially the doctors, are dying 10 years earlier than the rest of the population. The overall expectancy of life in India is ranging between 65 to 69 years, while the doctor's life expectancy is ranging in few of the studies done in many parts of the country between 55 to 59. So this is a very dangerous situation. This is a very pathetic for this community of doctors and also for the population, because once this community will remain in so much stress, many people will not be thinking to become doctor to accept this profession. So if we really want to make this profession lucrative as it was earlier, we must think where is the fault and how can it be corrected. For this reason, today's topic we are taking on the mental health. So today's our agenda is on the mental health in the doctors. That is mental health management for healthcare professionals, and for this specific topic, we are having a very prolific speaker, Dr. Anurag Verma. He will be introduced well by our well-being champions. I must tell you the well-being champion concept also. ACP is having a tradition of developing few doctors as a well-being champion. What does the doctor supposed to do for the well-being? Actually, they are supposed to do work for the well-being of their own fraternity. From India, I was the first who has been qualified and done this course of the well-being in 2018. And after me, few more doctors has done this. In between, there was a gap of the 2 years of COVID. So that's why nobody could be nominated for this. This year, our ACP Advisory Council has nominated two of our colleagues for this well-being champion course, Dr. Anubha Srivastava from Allahabad and Dr. Srinivas Murthy from Bangalore. And both of these doctors will complete their well-being champion training, and after that they will be given this title of the well-being champion this year, and they will also be taking lead for doing the well-being program. They are still doing the well-being programs. They are supposed to do the well-being program. I think every doctor who is concerned of this thought, he should do, and he is supposed to do such kind of the programs on virtual platform as well as physical platform. But these two doctors are being especially trained for this well-being of the doctor. So they will be taking this idea, this thought, and this awareness across the country very soon. And in fact, they have started it from today only. So without taking much time of you, I will hand over the proceedings to Professor Dr. L. Srinivas Murthy, would be well-being champion of this year, and he will take you the further program. Over to Srinivas Murthy.
Thank you, sir, and good evening, friends, gentlemen and ladies. I think today is a very auspicious day for us because we are beginning our well-being champion task, which is nominated by our governor, Professor Anuj Verma, sir, and myself and Anubha are the two people who are supposed to be a well-being champion, prospective, of course, and we will definitely keep up his expectations. I know it is very difficult, but we will definitely sail through. That's our confidence. And today, on the occasion of World Schizophrenia Day, we wanted to begin something related to mental health, though may not be exactly schizophrenia. We know mental health includes our emotional, psychological, and social well-being, and that is where it affects our thinking, our feeling, and our acts and deeds, and which has to be handled through our stressful life. And we know the stress starts from when we join our MBBS as an undergraduate, then postgraduates, and it multiplies or it quadruples when we become consultants. And off late, I'm sure all healthcare professionals are undergoing tremendous stress with the pandemic. And then post that, handling patients and the relatives of the patients become really a headache for us. It's become an extra burden. And just to tell you, the mental health is important at every stage of life, in especially a doctor's life. And that's something all of us should be able to overcome this stress in our routine clinical practice. Just to tell you a few statistical numbers in US, about 1,500 healthcare were interviewed, and they found out 93% of healthcare workers were experiencing stress. 86% of them reported anxiety, about 77% reported frustration, 76% exhaustion and burnout. And this is something all of us should note down, that COVID-19 was one of the excuses, but otherwise, literally every one of us, through every day in and day out, as doctors, we have been undergoing this stress. So this emotional and physical exhaustion has to be tackled, and not getting enough emotional support is something we have seen few of our colleagues getting succumbed or sucked because of this emotional stress and ending their life halfway through. And that's something very disheartening, because our own colleagues were supposed to be managing this stress efficiently, succumb to this. And struggling with parenting is another problem. I'm sure Dr. Anubha is one of the doctors who had the people with children, because we were hesitant. In fact, myself during the COVID, we never used to get into their rooms, and we used to be isolated in our own house. And that's something was definitely a tough time for all of us. And well-being among healthcare professionals has to be considered in today's era. It includes your physical and mental health both. And mental wellness, we know it's an important pillar in management and in our own lives. And to create this awareness, today we have Dr. Anurag Verma, who's a fellow of Indian Psychiatry Society, fellow of Indian Association of Child and Adolescent Psychiatry. And Dr. Verma is a consultant psychiatrist currently at MLN Medical College, Prayagraj, and it is medical schooling initially from Armed Forces Medical College, Pune, one of the renowned institutes, and MD DPM from Grand Medical, Mumbai. He has been working with clients in psychiatry and also loves teaching in subjects, especially with clinical aspects, which is still the key in being a good mental health worker. And Dr. Verma has been awarded in the college colors and was a cricket captain. So he's literally got mental and physical well-being himself. So what we preach, we should follow. So he strongly believes in that. And he's still an active sports person, and sports psychology is an active area of interest for him. And he's published many papers on depression, illness, suicide, dedication, and medical conditions with psychiatry manifestations. He has contributed a chapter also in our API textbook on cognitive manifestations and hypothyroidism. He is actively involved in information and education on public health matters, and through regular lectures. He's been on radio talks and newspaper, so all social media platforms he's been very active. He's been a past editor of AMA and presently vice chairman of IMA AMS at Allahabad chapter. So we have a great person to discuss, and we request all our colleagues to post their questions in the chat box, or you can open up meanwhile and plan your questions during the course of the lecture. And we would want this to be interactive, and please be happy to ask any questions with respect to this, and we will be very happy to discuss in the panel discussion. Sir, we heartily welcome you, and thank you very much for accepting our invitation.
Thank you, sir.
And over to you, sir. Slideshow, sir?
Yeah, slideshow. Are my slides
no, not yet, not yet. Visible slideshow is not yet done. Yes, perfect, sir.
Good evening, everyone. Thank you for a kind introduction, Professor Srinivas. Dr. Anuj Maheshwari has always been so encouraging. Thank you for having me here. I thank the India chapter of ACP for on this World Schizophrenia Day that they have considered mental health to be shared today. As has been already alluded to by Professor Srinivas, mental health is becoming increasingly important, and hence the need to understand it. The World Medical Association has written many times, many articles have coming where physicians, by just practicing their profession, have becoming more and more stressed, and this is because of the limited resources governments allot to us. If you see the budgetary allocation, even with the COVID pandemic, we did not get much of budgetary allocations. Sensationalist media reports, the corporate hospitals being micromanaged by MBAs, and reports of unethical physician conduct, challenges to our authority by the patients, and all this is leading to increased number of stress bias. Statistics have shown that stress is not just harmful for us medical professionals, but stressed doctors make more medical errors and also lead to clearly poorer patient outcome. Dr. Srinivas had already made my work easy. There have been certain researchers, not much, but Shanefeld in 2015 did a paper, and he found out that surgical branches, urology doctors have experienced the maximum stress. But if you can see in this slide, even branches where we expect that the stress level would not be so much, like pathology, like dermatology, even they are not unexposed to stress. There was actually a meta-analysis which we considered to be a gold standard for us to find out our researchers. And here also, even the incidence was not as high as in the previous paper, but all the specialties, especially surgical specialties, a lot of doctors and residents have increasing stress, as you can see. Even in the Indian scenario, and what the worrying thing out the Indian scenario is that stress is even complained of by our undergraduate and resident doctors. Depression, anxiety. If you know, the incidence of depression is around 12 to 15% in the general population. If you can see in this slide, doctors complain about it 4 times as much. Core psychiatric illnesses like anxiety. We have seen so many instances of doctors committing suicide in Rajasthan, which caused such a lot of hue and care. But now again, it has been brushed under the carpet, and the culprits who led to the death of the doctor have already out on the bail. So all this is leading to a lot of frustration and stress among our colleagues. Dr. Sandeep Grover, who is one of the senior psychiatrists in the country, works in PGI Chandigarh. He did an online survey, and just before COVID, he found out that 67% of Indian doctors complain of mild to moderate stress, and this amongst them, 13% can have core psychiatric illnesses like depression, anxiety, substance dependence, and obviously may lead to suicide also in these patients. In COVID times, there was a study in Punjab, and this study highlighted that stress can be as much as 80%. Dr. Srinivas also had similar statistics, and this study also brought out that female physicians have more problems in dealing and tackling with stress, and they develop more psychiatric illnesses, which is actually true also. If you see the statistics, anxiety and depressive disorders are more common in females than males. This is maybe because, not because they are biologically vulnerable, but even if that may be, even our society is not very female friendly, even if we become super specialists in our branches. A word about COVID-19. There have been many studies, and COVID-19 has actually not just, but it has actually amplified the kind of stress which is already there. And all over the world, in Iraq, in India, in Korea, all over China, we found out that depression, anxiety, other psychiatric illnesses can be as high as 50 to 60%. Half your colleagues would have depressive and anxiety symptoms sometimes, especially during the COVID times. Even we did a paper in MLN Medical College. We did it initially during the first pandemic. And we also found out that we did a survey monkey, and even on our colleagues and healthcare workers, all of them observed increased depressive features, anxiety features. A lot of time they complained about quality of sleep and persistently worrying about their own personal and familial health. We know the statistics. Now I'll start with like, what is stress? I'll talk in general a bit about stress and then slightly more specific about stress in doctors and stress which happened because of the COVID and its associated lockdown. Stress is as simple as if there is so much pressure that it overwhelms your adaptability, we can go into stress. Stress is not just negative. Sometimes, as we all know, just before our university exams, or suppose if we have certain medical emergencies, or as you all know, like if during an athletic meet, that adrenaline rush sometimes allows us to do certain tasks which might seem too Herculean during normal times. But the problem happens if this stress becomes too much, or if it continues for a long time, or if adaptability starts becoming low, then it can turn into negative stress, and obviously with poorer consequences of both our body and mind. Stress is evolutionary. Body from times immemorial has been uh, tuned to fight stress or fly away from it. So what you have to remember, if there was no stress, all of us wouldn't be there. Stress has allowed us to survive this time, but and by what it does is, we all know what is that what is that sympathetic system activation leads to. Within seconds of sensing danger or some emergency situation, our heart starts pumping vigorously. There is sympathetic system over, it goes into overdrive, your muscle gets primed for action, your senses sharpen, the pain is almost forgotten through the spinal pain getting mechanisms, the endogenous opioid system come into play, and neurocrine, endocrine, and immune responses all prime our body to overcome this stress. So if this is all good, so what happens? It is because modern times, neither can we fight the kind of stresses which we face now, neither can we fly away from it. Or if that stress response is there for a very long time, then this system can become catabolic with negative consequences, as we all know. And this can then lead to a variety of physical and psychological illnesses, or it can exaggerate already the coexisting illnesses which we all have. We all know that recovery after a myocardial infarction is actually dependent also in your psychological makeup. If post MI you develop symptoms of depression, your chances of recovery become as worse, and it is more correlated than just your ejaculatory factor. A lot of patients, like India is not very psychologically sophisticated. So we are sitting in a clinic, a lot of time patients, they come, they keep complaining about problems with digestion, with aerophagy, with having upset stomach. They would not come and tell you, "Ki, I'm having stress, I'm having depression, I'm having anxiety." We all know, and we just sometimes label them that, this is not important, you don't have anything, you go. But the patient actually is feeling those kind of systems because of hyperventilation. Technique can happen. The typical psychiatric illnesses, if you talk about it, skeletal system, patients, they keep complaining about loss of energy with fatigue, typical back pain, shoulder ache, and even our immune system, it gets affected. A lot of time people have asked me, is the correlation of COVID through immune system, is it just psychological, or does it do something directly to your nervous system? So what happens is, and because of this COVID, this was going on in research. We all know that pro-inflammatory cytokines like interleukin 6, which is being produced, what happens is that serotonin from our body is formed from tryptophan. And due to interleukin 6, the blood-brain barrier opens up. So there are more pro-inflammatory cytokines that enter the central nervous system. And these pro-inflammatory cytokines divert the tryptophan formation from the serotonin pathway to the kynurenine pathway. And as you know, deficient serotonin can lead not only to increased stress, but it can later on develop into psychiatric illnesses like anxiety and depression. So this is why this is happening. So psychiatry, as we all know, is psychosocial. So we have biological consequences through this, obviously psychological stress and lack of social support. All this together has led to increased stresses, and we are not yet, the pandemic is not over yet. So consequences of stress may be emotional, psychiatric, like anxiety, depression, nervousness, unable to control a mood, crying spells, irritability, uh, and irritability is being explored into, because irritability is just not a symptom. A lot of time it has been seen that irritability in children, irritability in interpersonal relationships can lead to so much stress, unable to communicate. Then, as I've already mentioned, somatic complaints, all kind of complaints, young people having sexual problems because of this, and again they get diverted to so many quacks, and this leads to a toll. We have behavioral issues, especially stress in young children and adolescents. They indulge into alcohol, they indulge into substance abuse, and suicidality is like depression, alcohol, panic attack, this and feeling of hopelessness. This is such a deadly sort of tribe that young doctors, young people are committing suicide because of that. Cognitively, a lot of times stressed people say that I'm not able to remember. A lot of time they complain about forgetfulness, inability to control themselves, having negative attitude, feeling of worthlessness. And again, as I said, because of inflammation, because of poor immune response, we can have all kinds of physical disorders also because of stress. Uh, Certain people have come up and said, we had a very good time with COVID. Why are you getting stressed? So obviously, if something can be stressful for you, it's not necessary that it can be stressful for everyone. What happens is your genetic and physical makeup, and more important, about your growing up experiences. Sometimes early life experience, especially if you have an adverse event like death of a parent, or you do not have a consistent caregiver, if it happens before 12 years of age, can lead to a very sort of poor outcome. Whereas if you have seen your parents cope up, if you've been able to do things better, then you can manage stress better. Your patterns of positive or negative thinking, your peer group, your influences, obviously extremes of age, very old people and very young people do not do well at the time of stress. Education helps, marriage helps. It's consistently been seen that females, especially in India, marriage, social foundations, they are more vulnerable to stress as compared to their male counterparts. What are we stressed about? As we all know, so many things, especially illness, pandemic, insecurities, and as we have already seen, so many violent incidences against a doctor, and we have become like very defensive doctors because of that. And that again leads to moral dilemma for us. We see a serious patient, should we treat that patient? Should we refer this patient? All this is causing stress in us. Most of the common reasons what doctors come up and complain of is stress is long working hours, especially in private settings, corporate hospitals, even otherwise. The emotional aspect of the work. COVID again, so many, even I being a psychiatrist, I was also posted in COVID ICU, and seeing so many people not doing well, obviously it caused a lot of stress, especially in so many fields. Poor work-family balance, working all the time, neglecting our family, high responsibility, you are the breadwinner, you have to save yourself also, multitasking. Now, so many work, so many uh, 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 like if you go and talk to doctors who are working in the PHC and CHC, they're just not tasked with health, but so many national programs and other kinds of work are being heaped on them that this is taking a toll. Critical decision making, again, poor social life, fear of failure, competition amongst our own colleagues, critical comments. It has been so many times, like often comments by our own colleagues, they actually come to haunt back. And we should be very careful and just passing remarks on our own colleagues and Again, as I said, threats and hostility by relatives of critical patients is becoming increasingly a problem for us. Word about COVID-19. COVID-19 came as something which was very novel. We did not know what to do with it. Should we manage it with antibiotics, or should we chant or do prayers? It became a value crisis also for us. Should we save ourselves? Should we take care of the family, or should we expose ourselves in our work so much that it can lead to a crisis in our own physical safety? Financial crisis. A lot of doctors, single doctor clinics, they were shut down because of the lockdown, are worried about our own health. Work from home, initially welcomed by some, had a known sense of problems. I'll go into that later. And obviously, loss of social support because of this pandemic. If you just imagine this lockdown as a psychological experiment, as you can see, nearly 3 billion people faced lockdown, nearly 1/3 of the world population. As you can imagine, obviously, this would have long-term health consequences, and the effect of which we are yet to discover in full. Uh, Last year's physician compensation report, if you see, this is the American statistics. A lot of time, we, in spite of working so much, a lot of doctors complain we were not getting annual raises. Even if you are working, sometimes staff, because of the COVID pandemic, did not come up, or they got laid down. And this, then later on, we founded some challenges, like so many new rules and regulations are coming. We know that we have to give this patient oxygen, but getting oxygen for the patient required so much of bureaucratic work. So all this kept on increasing the stress on us, and that is why the level of stress in COVID was too much. Obviously, dealing with difficult patients, critical patients, and the danger and risk which COVID-19 was for us, all of us being doctors, which we were aware of that. Again, patient, if he's not doing well, it is so easy to go to take a legal recourse, and we have to face that also. All this has been leading to worsening and stressful situation. But as I said, every stressful situation has a silver lining. Again, even in this pandemic, a lot of colleagues said that they did find the job satisfying. They thought that their contribution made world a better place. And this was one of the most important happy points that our colleagues came up with. The gratitude and relationship which we built with our patients during that COVID time took us back to the good old times when the doctor and patient had a golden relationship, and we were considered to be so worthy. And as I said, this rekindled the thought that doctor is actually a noble profession. Being proud of being a doctor, providing information. If you see people from other fields, like all of us helped during the COVID by just not treating, but providing information and teaching them about COVID. As I said, lockdown initially was welcome. We can work at home. We don't have to go to regular office. Commuting became easy. But a lot of time when this became very long, we saw a phenomena which we called it as languishing. As for example, suppose we have our cell phones, it shows that we have just 5% critical battery and we are away from home, or if we are in a new city, the kind of fear we have, this is something which is languishing. You are spent, you're nearly empty, but yes, you know you can work more, but the kind of feeling, that dread that we might burn out is always there. A lot of time doctors complained that because of this lockdown, all the time we were switched on, working from home. Other colleagues also, even if, like, suppose you're a doctor or you go to the hospital and come back, but then you're staying away from your family. You're worrying about them. And if your spouses are working somewhere else, so a lot of time we were not able to sort of switch back our minds, go back, relax, keep on thinking. And this office, hospital, and home, the separation which did not happen led a lot of time to stress. Female physicians, because of work and home responsibility coming together, job insecurity, a lot of people getting laid off, and the lack of sense of control, and a lot of time management was also not helpful. This all led to increased stress. We felt like we're burning from both ends. We're not able to manage work, we're not able to manage home. Both the places, people are not happy. Sometimes to signal our efficiency, we started giving more and more time to the work, working all the time. Mornings became evenings, no weekends, and this kept on happening for months together. And this also led to a lot of stress, especially in females working from home. Your kids are there all the time. Imagine, like, if you're in the office, you can concentrate more, but in home, you're taking a critical decision, but your family is with there. It actually becomes more challenging, especially if you're working in presence of your family. So what is stress management? Now, all these things are causing stress, but what you have to understand is what is more important in stress management is, even if the situation becomes bad, we have to be able to maintain a sense of control, learn how to get the most out of life. This is the basis of good stress management. Interventions sometimes can help put away the stress, but more importantly, the aim should not be to take away the stressful life event, but should help us become more resilient and able to cope up with the stress. Uh, First away step of obviously stress management is our own sense of awareness. We are becoming stressed up. If you are not aware about our own stress, how can we take care of ourselves? So listen to your body. It does give you signs when you are stressed. First step, what you have to take in stress management is, can you change your stressor? If you're not able to change your stressor, can you reduce your intensity? Obviously, if you cannot change the intensity, can we take a small breaks from that stressful events? And most importantly, we have to give time to understand and importance to make a necessary change. As we said, healthy mind and healthy body are synergistic. We should never forget that we should obviously always exercise, if not daily, at least 3 to 7 times per week. Sleep is important. We all know, take a good nap and then a good healthy nighttime sleep. Keep your personal interests, your hobby, your vacations. Keep some time of your day for oneself and your family. Have a good peer group where you can talk, sound out, and clear value systems. A lot of time, because of this, we developed unhealthy relationships, and this became more stressful when we discovered that instead of we having colleagues, we are becoming emotionally entangled, and instead of becoming help, this is becoming more and more stressful. Day-to-day methods, all of you know, yoga helps, mindfulness, meditation, positive imagery, breathing exercises, close to nature. We, all of us, are living in a concrete jungle. Just going, taking a walk in the park is something bare minimum which all of us can do. Time management, as we say, especially work from home, lockdown, we lost a sense of time working in a single place. We should take all this into perspective. Even if there is a stressor and our primary appraisal of that stressor is that it is going to be very harmful, you start feeling worthless, helpless, you take back, you can actually ask yourself, can I control the situation? And sometimes taking a pause starts giving you more and more options. You can think more and develop coping strategies. Some of the common coping techniques which psychiatrists and psychologists use is cognitive reframing, restructuring, behavioral modification, and stop that automatic thinking that happens in an emotionally charged situations. We should try to make a cognitive balance. All in none thinking, overgeneralization. I remember, like, a lot of time colleagues said, this is not going to end. All of us going to not do well. If some colleagues had a adverse situation, we would also have this. So this kind of emotional reasoning, absolute statements, personalizing generalized statements to ourselves, or this lead to cognitive dissonance. And again, by taking a pause, we can sort of ask ourselves that are we having selective abstraction, or all this is just not that. You don't need to be a very good professional for that. Even if you sometimes ask something as simple as 2 or 3 times a day, if you just write down what are the automatic thoughts that is happening. If it becomes overwhelming, we can sound out our spouses, our colleagues, talk to them, then document our experience, and talk about media, obviously spirituality. A lot of time people did prayers and all this help. And once you do well in an adverse situation, and that data you can share, and you can actually help your colleague also deal with stress better. As we said, once we used to work from home and then we used to go to the office, it used to be like a boundary. Okay, that is your professional self, this is your home self. This blurring of boundaries also led people to get confused. So even like some people, colleagues in the IT industry are still working from home. So what they can do is they can make a certain corner of their home as their office and tell their persons at home, okay, now I'm here. This is like my office. So if you come to me for some work, or please take care that you do not disturb if I'm doing a critical meeting. You can actually change to formal clothes from your pajamas. And this actually also gives a messages to young kids and your family that no, you are in a professional mode and you do not need to be disturbed. Sometimes going to the office and hospital used to be the only physical exercises we used to get. So don't forget this. Take a walk before coming and sitting back at your home office also. So maintaining temporal boundaries, again, as I said, a lot of time stressful situations, if you actually stick to that old routine of morning 8 to evening 4, 8 hours of work, it is not possible. Actually, efficiency decreases even if you're working from home. It has been seen that 3 to 4 hours is the maximum input a lot of people were able to give. Also, as I'm taking a lecture now, it is 8:30 in India. Suppose you are working in an office where there is a multinational sort of team. If people who are east of you, their time would be late night. So you have to understand obviously that you have to make time zones. You have to sort of see that your work time is comfortable to them also. If talking about Western society, this would be early morning for some people. Here, for virtual offices and workspaces, the management can step in and try to coordinate and make time zones for all. All of us have lost friends, family, even colleagues. And this has led to a lot of grief reaction, not just in the family, but amongst us ourselves. So I'll speak a bit about if you have suffered through the loss of a colleague or loss of a family. Earlier, because of the rituals which are associated with death, the pain used to be collective. It used to be universal. We would be able to solve it. But now a lot of time we have seen that death happens, a single person is there for the cremation. A lot of time we were like out of it that the body was zipped, was sent to the mortuary. We are not able to even sort of experience the goodbye which we used to give. So the grief started becoming more personal and solitary. Ruptured social cohesion and remembrances which became overwhelming for us. A lot of time we started blaming ourselves. We could have done that. We could have done this. And this led to sometimes heightened emotions or stoicism, which means we were not able to express out how we felt in that moment of grief. What can we do if actually something bad has happened? Small steps like communication. If we see a colleague or if we see a person who is having this grief, we can allow that person to talk about the disease. Husbands can talk about their wives. Sons and daughters can talk about their parents. We can talk about restoration, future order. A lot of time we do not thinking if we start talking about what will happen next, we are actually not allowing them to. It's not like that. People want to organize themselves. They want to have a companion who can walk along to you, listen. It's just not that we share social media when we go for exotic locations. Something as simple as that. What are you cooking today? Did you have coffee? Gives a companion and feeling that, okay, there is somebody whom I can talk to and listen to. This helps if somebody is going through grief. Ask them, what was your pre-grief functioning? Not just sometimes brilliant situation, but just your nuance, how you communicate that person. That human touch is enough to make that patient come out of the grief. Children have an inherent belief that a lot of time we try to hide the truth from the children. But if the children are sophisticated enough, it is always a good idea that we tell them the truth. Sometimes religious rituals which have been deprived in COVID times also helps in overcoming grief. As in the end, a lot of times we talk about it, but the core features of happiness are the same. which have been there from times immemorial. We should not hold grudges. We should understand that relationships matter, especially the relationship with our friends, with our spouses, with our family, and obviously take care of your body. It helps take care of your mind. Obviously, there is no shortcut for happiness. There has been this Harvard study where they took a cohort right from the birth, and they are still following up, and some of the cohort is now more than 80 years of age. And again, they found out that it's not money or fame that gives you happiness. It is being flexible, being happy in relationships, and having a healthy life and body. That is important. I'll be ending now. And thank you all for the patient hearing. Thank you.
Thank you, sir. It was wonderful. You're definitely enlightened. I think you opened up our eyes with the last slide. I think all of us realized during COVID-19 that money or the wealth that we had was all useless. And it was all we were craving for oxygen, literally. And that is, I think, one eye-opener I think most of us have experienced. And unfortunately, people are falling back to the old track like a pre-COVID era. And thank you again for accepting our invitation and enlightening us. And over to Dr. Anubha.
Thank you, Dr. Anurag. It has been a really enlightening session. I would like to brief you a bit about, like Dr. Srinivasan and myself have been a part of a training program of wellness, and we have actually undergone training for past 3-4 months, and we have interacted with all the ACP well-being champions across the world, and we resonated the similar feelings of burnout, frustration among the doctors itself from, across the world. It was just not the statistics which you have shown in the Indian subcontinent or the global data, but it was actually at the workplace. The feeling of hopelessness, helplessness was the grief was paramount. So this has been a great, we had actually a great experience. We talk about what can be done, but I think this at our place being one of our initiative to talk on the stress management by our psychiatrist colleague who rationally pointed out about giving us insights on the issues of stress at the workplace, the environmental and the occupational stress, which the early care physicians face, which the residents face, which the doctors face, which you have very aptly pointed out at various levels, the factors and all are there. So I would have some questions, still we have some questions in the box. We were talking about lots of eustress and a distress. So lots of people are coming up and talking about, I am depressed. Do you think if I feel like I am undergoing a stressful situation, so I should feel like I am I should be diagnosed as a case of depression, or I may need medication?
As I said, stress is something which is universal. Stress is something, if it becomes prolonged, then we may have chances of going into depression. As I said, depression is an illness and it has certain characteristics. According to the DSM-5 and ICD-11, what we have to understand is a lot of time we talk about depressed mood very loosely. I'm feeling depressed. But what is important is if a person is depressed, he has that distinct quality of low mood, which is pervasive. It does not change. And the most important is there is a loss of control over you. Okay, here, if we change a scenario, the mood and affect gets changed. But if you're really depressed, so we have that inability to control our mood. It becomes pervasive. And besides that, feeling sad all the time, unable to take interest in daily activities. And as I said, that there are emotional consequences, depression and anxiety, cognitive features of depression. We are unable to concentrate. As you rightly said, the triad of feeling hopeless all the time, worthless, and feeling suicidal. You know, in depression, in the suicidal thoughts are felt by more than 50% of the patients, especially young people. And one of the features of depression is that early morning awakening. You are able to go to sleep, but your sleep you get awake around 2 hours before. The other features are loss or increase in weight of 5%. Okay, once you get up in the morning, a lot of people complain that you feel absolute loss of energy. In fact, loss of energy is complained of in 97% of people, nearly universal, very common symptoms, although it is non-specific. Uh, Sometimes people have asked me that why isn't crying a feature of depression? It is because crying gives you a sense of control. When you're very severely depressed, you even sort of lose the ability to cry out. So if we have more than 4 to 5 features which are constantly present for more than 2 weeks, then we diagnose that person as depression rather than just being in a stressful situation.
Very well. So for diagnosing depression, at least these symptoms should be present for at least 6 weeks when we label them as a major depressive disorder. I definitely, we need to have, because this was a similar question which Dr. Srinivasan has shared with us, because like we've talked about lots of stress and the stressful work environment place, which we have all faced during the last pandemic. So how to suspect it in our colleagues who are undergoing stress with, and as you know, they may not reveal, as you said, the crying is one of not the phenomena. So certain certain subtle signs if the patient doesn't want to open up regarding his personal feelings. So can we as a physician would have some alarming sign that this patient needs help, and definitely we as their colleagues could help them.
It's like, as you know, Matlab, it's like there's no single formula for everyone. But as you said, I've mentioned also initially, like if you talk about cognitive symptoms, being irritable normally in situations which we are able to take care. Okay, having problems with sleep, either not being able to sleep or getting up early. All right, becoming restless most of the times. All right, a lot of people talk about that I'm not able to concentrate well on my work. So this is also one of the very, very common signs. Avoiding work. A lot of time you see that suddenly the patient, our colleagues, they are taking frequent absenteeisms from work. Even if they are there, they're not interacting with us. And this mood is not just complained of by them, but actually we can also pick up that this person is not there. He does look not well. He does look sad. So all these signs, and as I said, that patients feel depression as a kind of pain. If you go into a depressive state, that pain, that depressive feeling is very distinct from the normal depression we have. People want to come up, talk about it. So if you sit with them, give them time, so they would open up, they would talk about their inner feelings, and then obviously once they communicate with you, once they discover that they would not be ridiculed or expected, oh, you are a physician, how can you become depressed? Then they do come up, they do talk about their feelings of hopelessness. They do talk about how helpless they are feeling in this situation. They are not able to sort of make a change and they feel like quitting. So all these signs, and they become very obvious. In fact, suicidality also has been so commonly seen. But as we said, that sometimes before committing suicide, there are certain cues which the patient gives. They actually also talk about it also, but we sometimes are not able to pick up. In fact, there are so many self-rating scales which you can just advise, okay, if you do not want to talk about it, there are certain rating scales which you can download from the net, easily available. Hamilton depression rating scales, or just a checklist. You can go through it. And if you find out there are certain symptoms which you find in them, say a score of more than 7 or more than 15 in this rating scales, I'm there. You can come talk to them, or you can refer them to your psychiatric colleagues. This is how you can pick up more patients who develop psychiatric symptoms because of their prolonged stress.
Dr. Anumba, may I ask a question?
Yeah, please.
Sir, in continuation with the scoring system, can we have a simple scoring you can tell us to our colleagues where we can give it to or hand it over to our patients in the waiting area, and when they come inside, especially the common chronic diseases what patients undergo, can we have a very quick scoring system or a scoring card which we can be handing over in the waiting area and we can pick it up and probably refer?
Yeah, in fact, most of the rating scales are now available on the net. Most of them do not have copyrights anymore. But we have to understand rating scales are not used for diagnosis per se. All right, rating scales are used mainly to rate the severity of the illness which you have found. All right, and once you make a diagnosis, it is also sort of corroborates or confirms your diagnosis. But yes, there are certain screening scales which you can use, quick patient checklist, and all, like most of the psychiatric illnesses, they have a rating scale. They are now very simple, available, all the vernacular language. So like if the patient comes to you for the first time, obviously, if you give him a rating scale, he'll be at C. But like once he comes to you in the first visit, you diagnose him with that, he understands that. On the second visit, or follow up when he comes, then it becomes more easier. If you give him a scale, he takes it, and then you can sort of find out whether he's improving with treatment, whether he's not, and also to corroborate what you have diagnosed. So that way, rating scales are very helpful. They are very simple, can be done in 5 to 10 minutes, and it's quite handy. It's a good question.
One question I would like to highlight. ACP always believes in making a better life for our early care physicians or our students or our residents. We talked about the suicide as per se. So what we have seen in the colleges also, certain branches, the residents, they may feel like having compulsion to or have suicidal thoughts, or they may have episodes of commission of suicide. In our own hospital, we have seen, in our own department, I think you might have seen some of our patients also, they that what you were telling previously about suicide. So how better we can express, or as a teachers, how better we can tackle this problem of suicidality, as the students are coming from all across the world with a background, with a different background, with a different environment and a genetic makeup. They're coming as an undergrad or a postgrad with a work pressure. Like first, I'm talking about the postgraduate department. Once the patient once the resident signs first death certificate ticket, that takes a very big toll on that student. So any steps where, as a teachers, we can barge in and this rate of suicide, or we can early pick up, as you said, there are always subtle signs which which they give, which you can highlight to us.
Actually, suicidal, like we say, there's students who are depressed, especially depression with a feeling of hopelessness. Hopelessness is one cognitive distortion which has been most sort of directly correlated with suicide. Also, if you see what is happening in young residents in the hostel, if you are stressed, they sort of we become so much busy in our work with our papers, sometimes in private practice, that we do not have an ear for them. And because of the work pressure, obviously they are not able to communicate. And what they do is substance abuse. So if you are depressed and if you start indulging into alcohol, and just not alcohol, cannabis, all right, obviously because of that, then you start having anxiety and attacks, and you don't know. You are depressed, you are taking an alcohol, you are having a panic attack, and then you go and immediately sort of do something which has very harmful. So before all this thing happens, you sort of, if you can make a difference, if you can just communicate, having communication. As it's been seen, a lot of time that if you actually have a dedicated phone, okay, if you can designate one of the faculties, okay, if the student feels like this, there's always time. You can just pick up your cell phone, ring on this number. I'll be there. I'll talk to you. I'll try to sort of see what kind of problems you are facing, whether it is with the patients, whether it is with your work schedule, whether it is something else, relationship problems. As I said, sometimes bad peer relationships are being made because of stress, and they become a complication onto themselves. So if you talk about them, and as I said again, sometimes the methods they choose, deliberate self-harm, sometimes like taking some pills and all. Patients have suicidal ideations, but they do not complete suicide, especially seen in females. But if you are using a dangerous method of suicide, if you are using a violent method of suicide, or if you try to have a serious attempt, you are not successful. These kind of patients are very vulnerable, and we have to have an eye for them and take special care that they do not sort of do it again. So this is very important.
Sir, any relationship between the physical fitness, physical activity versus depression?
Yes, as I said that cortisol has been like now talked about a lot in depression, like cortisol and inflammatory responses. And we all know physical exercises help improve our circadian rhythm, helps decrease the cortisol levels. It is, in fact, it helps increase your brain-derived neurotrophic factors. It helps increase your nerve growth factor. It helps improve your sigma receptors. So exercise is not just like helps you. It has biological reason. Obviously, it has psychological reasons. If you are healthier, and obviously exercise and sports, it helps build up peer pressures. Exercise also, if you remember sports, if you've been playing sports, you know sometimes that it's okay to lose. You might lose today, but you would win tomorrow. So it helps build up more resilience also. So exercise, playing sports, which is so often neglected. As I said in that previous slide, the only sort of pastime for the resident doctors was just listening to music, nothing else. If you remember, our senior colleagues, they talked about inter-batch sports, they talked about cricket, they talked about so many sporting activities, and they still talk about it when they meet their older peers in their 25-year meet, 50-year meet. So exercise definitely one of the best things that we can do, and a good, very important point to be highlighted here.
I think Dr. Padma Gulati has brought up that listening to music is one of the stress busters or stress relievers.
The common is stress buster, but what I'm saying is it should not be the only stress buster. It helps, but obviously we should not forget you're just doing this and that's okay. Should be with other things also.
We have another question in the chat box. What do you suggest the authorities, organization, and government to take steps or introduce policies which will help to reduce the minimal stress at workplace?
Mental stress.
Yeah.
Government like initiatives, I don't know if it's it's like really going to work, but yes, as I said that government also can nowadays, like a lot of time unnecessary litigation. Okay, documentation should be good, documentation should be at point, but obviously we should be helped, we should be given a system, just not that the documentation is heaped up on you. Obviously, a lot of time, actually, when we see that there is this order, suddenly it happens, and you're supposed to reply to that in a day or two. So it should be like proper planning. Obviously, infrastructure is built. Obviously, a doctor is posted, and then there's nothing else. You're not supposed to work in this kind of way. So, like I've seen so many medical colleges, seats were there 120, then 150 and 200. But the same theater, the hostels are the same. So if in the initial steps, like in a single room, like 4 resident doctors, 3 undergraduate students living. So it should be a holistic approach. If you are trying to do something, so try to build up from the grounds up. The government should also have proper legislation. They should build up a proper legislation. They should talk about a holistic medical education. And obviously, planning should involve doctors. A lot of time, like in the government planning, it is more of bureaucratic planning and it is becoming a top-down approach. It should be it should not be like top-down approach, and it should, like, government should sound authoritative to us. So participating, having your word out, having discussions, all this is very important. In fact, the reply to this question, I'll say, like, even I would like to hear Dr. Anuj Maheshwari's response, because obviously he's so much experience working with the government sector. So I'll request you also, like, can you like come out with certain suggestions? What should the government do to improve our mental health?
Even when what a safe work environment also, that also policies should be there. So many violent cases now happening. Sir, we'd like to have your opinion also.
Yes, in fact, I was just thinking, how can we really make this more vulnerable situation ease going, and how can it be comparatively more easy going for life for the doctor? So two, three things comes in my mind. One is the working hours should be reduced, because until unless we don't have the enough time to do something for ourselves, some recreational activity, there is a taboo for doctors. Even if they organize some recreational activity or some musical program, then people think they are doctor, they are not supposed to do that, and they are why they are doing that. Next, if newspaper wala can come out with some kind of the photographs, and these people were enjoying there. So this kind of the taboos should be avoided. Somewhere we have to develop this kind of the thinking among the people of society, that they are also human beings, and they should also be allowed to live like any other person is living. Most of the time, doctors does not speak up. They come to the verge of extreme depression. They go for the suicide kind of the situation, but they don't speak out. And as Dr. Murthy has very rightly said, the biggest problem among the doctors and healthcare workers, our other healthcare workers doesn't have this problem. Mainly the doctors have this problem. They don't tell about their problem to anyone. Even the problem what a person is having, he doesn't tell to his wife. Even if she is doctor, both husband, wife, both spouse are doctor, they are not having enough time to listen each other's issues. They are busy in their issues, and only at the time of dinner table they are meeting with each other, and apart from that they are busy in their own. And if a person is reaching up to the extent of maximum, and he is not communicating to any other person, so this is the biggest challenge for us, how to get the problem from them people. How can we ensure the communication? A lot of residents reach to the highest level of the depression because they don't communicate. They don't communicate with their peers. They don't communicate with their teachers. They don't communicate with their seniors. They don't communicate with their batchmates. And because of what a lot of such events happen. So first thing, that working hours should be reduced. Second thing, the people should be given some opportunity of recreational activities, some opportunities of the everything should not be in the exercise. Exercise is a kind of the things, either you see the patient or you do the study, and third option is you do the exercise. So on social platform, we tell that exercise should be promoted, and definitely it should be promoted. But we can find the ways of exercise in the form of the dancing activities, in the form of the singing activities, in the form of the things where body movements must be involved. So like doing the skit, like doing the plays, and these kind of the things should be encouraged among the doctors, so that their talent may also come out. At the same time, their relaxation would also be there. Doctors are the cream part of the community. They are the highest qualified part of the our society, because they are those people who are separated at the 12th standard. Once they clear the 12th standard, they just get filtered out, and after getting the filtered out, whatever is left, it is for the all other profession. Whatever is left. So that filtered cream is in this profession, and that is a good luck for the people of this country, because they get the cream of the society in the form of doctors. It does not happen in other countries of the world. That's why the Indian doctors are supposed to be the most demanded in rest of the world. Wherever you go, you will find the Indian doctors are in the highly demand. But in our own country, the things are not like that as they are in the Western countries or in the United States. So somehow we should make the situations in which we, instead of competing with the doctor, we should make them a good atmosphere. So they can serve you better, at the same time, they can find a better life for you. Otherwise, one day will come, nobody would be opting the medical profession in India, and India will face the biggest health crisis at that time if we shall not be doing anything, if we shall fail to act at this time. So this is the high time to act, what I can say.
Very well said, sir. Uh, small, subtle steps, if taken, can definitely make go on a long way to solve these problems on stress related issues. Stress management is an essential component for well-being of doctors, and definitely mental health is very important. So today, on a very special day, we have begun this journey of mental health, not but we just talk about a total well-being for our fellow doctors. So
What comes in
yes,
my mind, Anupa,
yes,
when Anurag was saying about the positive stress and negative stress, so I was just thinking about my resident time when I was resident, and when we were set to do the duties of the 36 hours and 48 hours. We were posted for 48 hours or 36 hours in the ward, and that was the actually positive stress, because that was the stress with which we could become a very good doctor now, or whatever we are now. That was the stress for making the people something good, and making the and taking out something very good talent out of the person. So that positive stress is there, but some when this positive stress is mixed with the negative stress, nobody knows about that, and somehow the things gets so much stressful. Gradually they gets transformed into the negativity, and things becomes bad somehow in any form, one form or another form. So we must look over the procedure of that transformation. The positive stress is becoming the negative stress when this transformation is taking place. Maybe a point of the thesis, maybe a point of the scolding on the round, maybe a point of the uh, some bad management of the patient, or some patient's relatives mishandling or manhandling might have been there. So multiple reasons may be there, and doctors are the only uh, community or only professional who are directly responsible to the society. There is no in between us. We are directly dealing with the society. There is no police, no advocate is there between myself and my patient. So if my patient is doing something bad towards me, or I am getting some mishandling from my patient, in fact, nobody is there to help me at that particular time. Here, one more thing I would like to say: a art of communication. Art of communication is the most important thing which we never teach to our forthcoming doctors or our residents or our students, because that art of communication uh, ease out lot of problems. Once you are in the very bad situation, your patient is going to die, you are surrounded by the people, those who are having weapons and all that. But good communication can resolve every problem. And I think Anurag must focus in his next talk on the good communication. I can see that Anubha is very good communicator. So I wish that Anurag will tell us how can we all become the very good communicator and how can pass on this art to our next generation doctors, so that the things may be resolved by that. It is said by many people, if you are a very good communicator, 90% problems are just solved because of communication. Only 10% are requiring your skills. So that is the thing that I don't know how much Anurag will support this. Only he can tell.
Sir, I actually mentioned this in my talk. It's not what you say, it's how you say, the tenor, the nuance, how affectionate you are when you're talking to a person. That makes even more of a difference than the actual content of your talk. So very rightly said, sir. And this is the art of communication is more important than the content of communication. Absolutely true.
No,
The
definitely, sir.
content you can never change. Content, if some patient is going to die, you can't say no, he will not die. You have to tell the truth, whatever is there. But
How to break the news
what
of
is
the
the way you adopt to telling the truth, and how you communicate the relatives, and how can you disclose this? That is the art, and that art we must try to learn for ourselves, as well as we must have some classes or some kind of the tutorials for our residents also, so that they can come out of such kind of the situation if they fall prey in these things.
So here I would like to point out this NMC, the schedules which we now are having, we have, I think Dr. Anurag has already taken how to communicate. They are like in the foundation courses. Now we are having these type of topics for our undergrads. They are being trained, as you were saying. I think small changes can be seen at the policy making level, that people have started pointing on these aspects, the communication skill, even how to train our residents, when to break and how to break the news to the relatives. So these are very good topics, and I hope we can schedule these talks for our next ACP meeting on well-being, because it's essentially
One thing
important.
is coming to my mind after
Yes,
getting your this idea from you. Then next time we can plan some program for residents and students, and we separately for the students, separately for the resident, and we can ask them to register for this kind of a program, and that program remain online on the communication skills. With the help of you both as well as Anurag, we can plan this kind of the program, and we can find out some more people who can be helping us in that. And those communication skill workshops, or those communication skill small programs, symposia, workshops, or uh, uh, can be organized for the residents and students in the students training, or student skill programs, or as a resident skill program kind of a thing. So I think both of you start thinking in that direction, and hopefully we can do this if you can work upon that.
We'll do it, sir.
Definitely,
Sir. It's a very good idea. In fact, I think it's actually going to help.
So I think it is 9:15. We have already completed more than 1 hour. So anything more is left, or we should close this session? I think there is no question in the chat box.
Yeah. Dr. Anubha, vote of thanks, please.
Who is saying that I wanted to know experts' thoughts? Somebody is saying thank I think
is forwarding to us. Yeah.
yeah,
forwarding from the-
we don't know who is asking this. So, but all the questions we have covered up.
Yeah.
Yes, sir.
Dr. Anubha, vote of thanks.
So thank you, ACP India chapter. On behalf of the ACP India chapter, I would like to thank our governor for giving us this opportunity and giving us valuable time to start this series on ACP well-being. And I would like to thank Dr. Anurag Verma for giving his expert opinion
Thank you.
and his
My
time.
pleasure.
And my colleague, Dr. Srinivas, who came up with this idea to highlight the issues regarding the stress management on another very important day of World Schizophrenia Day. So mental health is really very important, and we want a holistic approach for physical and mental health. So thank you, and thank you all our delegates and viewers who have joined us for this session on ACP Gadget. Thank you.
Thank you. Thank you, sir. and good
Thank
night.
you. Thank you all for being with
Good
us.
evening, everyone. Good night. Thank you.
Good night.